Ever wondered why a doctor decides to implant a pacemaker in a patient? The decision to implant a pacemaker is typically influenced by the symptoms of a bradyarrhythmia or tachyarrhythmia, especially when these occur in the presence of heart disease. This isn't a decision that's taken lightly, it's a pivotal choice in managing a patient's heart rhythm and their overall health. So, it's all about managing symptoms and improving the patient's quality of life. But when exactly is a pacemaker necessary? The most common need arises from SA node dysfunction, leading to symptomatic bradycardia and hemodynamic instability. This can manifest as syncope, pre-syncope, or severe fatigue. The causes? They're varied. It could be an intrinsic disease within the SA node, abnormalities in the autonomic nervous system function, or even the effects of certain drugs. In other words, a pacemaker can be a lifesaver when the heart's natural pacemaker isn't doing its job. Like any medical procedure, pacemaker implantation isn't without risks. Complications can arise during surgical implantation, from issues with venous access leading to conditions like pneumothorax or hemothorax, to challenges with pacemaker leads causing perforation or malposition. There's also the risk of pocket hematomas and infection. Moreover, complications specific to the pacemaker itself can occur, such as a failure to pace or sense, pulse generator failure, pacemaker syndrome, and even pacemaker-mediated tachycardia. Despite the risks, the benefits of a pacemaker usually outweigh the potential complications. How does a pacemaker keep the heart beating at the right pace? Well, this involves a variety of pacing techniques. We have temporary techniques, which can be transvenous or external, and permanent ones which involve transvenous placement into the right atrium, the apex of the right ventricle, or both. Modern pacemakers are quite clever. They can sense and pace the atrium, ventricle, or both, plus they're rate responsive, adapting to our body's physiologic demand. In essence, pacemakers are sophisticated devices that help keep the heart beating at the right pace.